Rivera. Let's keep it going with the mayors here. Sin City in the house with Sinajana Mayor Robert Hofmann. Morning, Mayor.
Day, good morning. Reporting live from Sinajana, your field reporter.
Central Division.
I always wanted to do that. Central Division. I always wanted to do that.
Oh, Lordy.
Oh, Lordy. Mayor, just... I guess just first of all, we've been hearing all the mayors say that. Like, no mayor that we have talked to since we started this has said, I'm really very well informed, and I really just want to say thank you to the COVID response team for keeping us mayors in the loop, and just making sure that we go out there armed with the best information. No mayor has ever said that.
We're aggressively able to prepare for
right, which I think mayors. It's just unfortunate because you guys are a great resource out there in the front line of the villages. You know what I mean? Mm-hmm. The governor's office, public health, they can't go out in the villages like you guys can. They don't know the villages like you guys do. Yeah.
Thank you, and we're trying our best. We had our first we had a press conference with the physicians group on Sunday.
You had a press conference?
Zoom. We had whatever. So we had a Zoom conference with them. Well, sorry, not press. So we had a conference with the physicians because we raised our concerns about getting the issue, getting what we need to know and stuff, and they keep coming back and saying, well, just treat it like everybody has it. I said, that's the hard part, because if everybody has it, it's exactly what Mayor Louise said, is that people are still going out and about doing these things. Some people are still going to work, and what kind of raised my concern yesterday is when you saw the JIC announcement. I think it was number 43 something. It said 2 of them are homeless, and so how do you shelter in place homeless? And if they are homeless, are they going to the soup kitchens? Are they going? So that means there's 70 people that eat regularly at night at the Ministry of the Homeless. So do they practice social distancing and other things? Not really. We don't know these things. So it is a big concern, and so we just constantly keep asking, please tell us the villages, tell us who, so we can kind of help flatten this curve. But they seem that they feel they know better.
Yeah, Mayor, I wonder because we have asked questions like that, but it seems like, I don't know if they're using it as a caveat to just say, oh well, everybody has it. That's that. Because it kind of seems like they're just saying, oh, just assume everybody has it, and that's that.
And that's the hard part, is that, okay, so if everybody has it, then let us all stop doing our food deliveries. Let's all stop asking people to come around and pick up lunches. Let's stop all going out there and doing the other things that we are continuing to normally do, because I know tons of people that still go to work,
right,
and have to go to work. So if they have it, can we just treat it as, hey, I'm not going to go to work because apparently I supposedly have it? So it's really hard to say. So I understand by reducing the numbers of people out there, it reduces the risk, but there's still a risk for it to grow.
Yeah.
So it is a massive concern for us.
Yeah, and I'm pretty sure they're saying act like everybody has it because of situations like this where you have people going to half-a-day bingo. There was a cluster there. We didn't hear about it anymore because I feel like I don't know who it was. Was it Dr. Cabrera or somebody that we talked to? Maybe it was Linda. Talking about trace investigations, they're basically at a point where they feel like doing trace investigations is almost moot because, like you said, we have two homeless who they went to the soup kitchen. They did this. I mean, we don't know how many people they came into contact with, and I think it was the governor in her press conference maybe 3 days ago where she said that we are discovering new cases faster than we're recovering.
Yes, and that's the thing. Is, if the homeless, of course, they have no travel history and they got it through community contact, could it have been spread through money? Because, there's cases I've read in reports where they're saying the COVID can stay on money. So could it have been somebody in a car handing them money, and then they take that money, and that's how they came in contact with it? Because, they wouldn't have these kind of close contact. Or it could have been somebody coughing up a storm in their car, and then they rolled down the window and hand them something. So there's so many questions, and I think that's the hard part for us, is trying to get ahead of this and get some answers.
Right, and I think that there are even more questions because the science on this, it looks like if you kind of Google, like negative COVID-19 test results or, sunlight effect on the coronavirus, you get so many different answers. So it kind of seems like the science and even how it's transmitted, they're talking a lot about fomites, but then you talk to one doctor and it's like, oh, hard surfaces like steel and plastic, the virus can survive for, X amount of time. But then we talked to someone yesterday and they said, to-go containers. Yeah, they can't really survive on those. So I'm just not. There's not really a lot of. It's almost like the information's still developing. You know.
Mm-hmm.
It is, and I was watching CNN this morning, and Dr. Fauci was just saying that they're discovering that it's not COVID is not just for people who have other conditions. It's also affecting now people that they're noticing that are healthy people. So they're trying to figure out what is that reactor for them that actually makes them sick. And they were very healthy and very active, and so it's now raises the new question: are these CDC World Health Organization guidelines correct? And so you're right. It's a science. It's constantly moving. So as they kind of examine more cases, so that's kind of why we're trying to figure out what can we do.
Right.
And you in Saipan, I don't know if you heard, but the youngest positive patient there is 14 years old.
Wow. See, no, I did not hear that. Wow.
Yeah, and I just had my 16-year-old son last week. I mean, they think that only older people get it.
Yeah.
And so he was like, yeah, but there haven't really been any teen cases. I haven't really seen any. So now we got a 14-year-old in Saipan.
Yeah, it is heartbreaking, and as you hear the stories around the world of either the success stories of the recovery, but you also hear the tragic stories of the loss and of these families, of these people who are fighters, who are doctors, who are frontline people, the NYPD. You had all these first responders, so it is hard to fathom of what this is and how this is really going to grow in our community, and how is it going to affect our community, and what's going to look like after.
Right. I mean, I'm not even thinking about what it's going to look like. And not even having to go all the way to New York to see these stories of these first responders. The press conference yesterday, Lillian Posadas, they kind of dropped that. How many Guam Memorial Hospital staff?
5 Guam Memorial Hospital staff, and she messaged me last night with the breakdown, and I know she's busy. She said of the 5 employees, 4 nursing staff and one dietary.
Wow,
that was the breakdown.
Yeah, so
and how does the dietary get in contact with that? That's kind of the hard part, because I know I don't think they're the ones who deliver the food, unless I think it's the housing aides or whatever their assistants. They're like dietary aides, but hoping it's not somebody in the dietary department, because then
and then
that's somebody who goes to the whole hospital.
Right. And then when you hear this news that we have 4 GMH staff that tested positive. 5, right? Because there was another one.
No, 5. 4 of them nursing staff, 1 dietary.
Okay, so when you hear that, it kind of really gives more life to these concerns about moving the maternity ward out of the Guam Memorial Hospital, which last week it sounded like it was a priority. The people who were involved with the process were saying, yeah, we're going on tours, we're doing this, and then it's almost like they threw cold water on it, because now Lillian had said that, hey, that's still in discussion, and now it looks like they are focusing on moving out the elderly patients out of the hospital.
Right, the adult patients. That's the priority, is moving the adult patients out of GMH, and then the talks are still, nothing's set in stone, to move out the pregnant women.
But I can't imagine the anxiety of these just people who are at GMH, knowing that we've had a staff that's been so unfortunate that they're exposed, and they contracted this virus.
That's across the country too.
Yeah.
And it's going to be hard if public health has to do the tracing and tracking of that too, because how many rooms are in that in the hospital, and what patients was that nurse assigned to, or what person did that, and then it has to grow from there. So,
and that's the thing. Difficult. That's the thing. I mean, I just don't know if public health has that many people to do this many trace investigations, and so I can see why it would help if they spoke with mayors to assist in.
Well, we
in all
asked
of
public
this.
health. We told them, I said, use the other agencies, have the other non-essential agencies workers come in and help them. They can make phone calls, they can do follow-ups, they can do house visits and monitoring and surveillance, but it's something we did ask, and we repeatedly asked on Sunday again when we had our meeting, and we've also brought the issue about the maternity ward. I know Mayor Rivera, that's one of the things she brought up there. So we're hammering at it, and we're asking the questions as well.
I wanted to ask, since you guys don't get the information from the Joint Information Center in terms of what positive patients are in what villages, so what are you doing in the interim to make sure that... I
know my residents, the families that do tell me in confidentiality that their family member has it, they do tell me, so I'm aware of who has it here in my community. But that's because the families told me. I don't know if there's more than that many that they have told me, but we're assisting that family as much as we can. And the other day, VIP restaurant actually donated masks to the mayors, and so that was kind of pretty cool on that end, of cleaning supplies. So we thank them because they stepped up. So we divided that out. Yes, it was 195 masks and 500 of the surgical masks, and so we've deployed that out immediately because that's what we're using to deliver these foods. Because
Mayor, who donated that?
VIP restaurant.
Okay. Oh, wow. Did they give you any honey walnut shrimp?
I wish. Actually, I'm allergic to shrimp, but I was thinking a salted pepper pork chop.
Right. I'll take it too. Sorry.
So they've been great. So the community is stepping up, and Crystal Paco's arranging to get masks to us from. I guess there's a bunch of really nice community volunteers that are sewing. So at least they're also thinking about us on our end here, and we've had some really nice people just in our different communities drive up and give us boxes of gloves that they found at mini marts or everywhere else. So they, at little stores. So we really appreciate all that they're doing. So they're really our COVID heroes as well, because we're delivering about 1,000 some meals already, and that's a really big task for us, and that's what we spend most of our mid mornings and doing. And so we're usually done delivering by 2:00 in the afternoon. But from 11:30 onward, you have hundreds of people just going through the villages, driving, and that's the thing. If we're not aware of who has this, is that one volunteer who's trying to do the best work being exposed to it? And so we don't know.
Well, I think it's great that Crystal can get you guys masks, but not get you guys information. So, all right.
Wow, jab.
Yeah. Mayor, what about?
You're not the only one frustrated.
No, I agree. No, and that's the thing is that it's taken a while. It's a request we've put in since for a while, and we understand. Give it to the frontliners, give it to the fire department, give it to the hospital to take care of those. Give the stuff that they need at the hospital, take care of what they need. So we're constantly saying just take care of them first, and if you do have extra, think of us because of our exposure to the community, because of what we're doing. Our essential employees that are out there, and I feel bad for them, and our employees are scared. And Mayor McDonald raised it that several of our employees are also on home isolation, and are not home isolation, but they're self-quarantining under the advice of public health, or because they may have potentially been exposed. So some of the staff are actually a lot less, and I feel bad for some of these mayors because they have maintenance people out, they have clerks out, they have administrative people out, and so we're kind of just waiting for this wave of work to come with all these individual assistants and all these requests for verifications as these the stimulus program gets rolled out. So we're saying, let us know ahead of time, and if you're a resident and you're not on a residency form, call us first and verify if you do have a residency record, and then get that information in there, just so you're in the system itself, because we don't want house visits. We don't want you to come to our offices in this case in this manner. We don't want people on the road. So just call your mayor's office, check if you're on the record. If you're not, then there's steps the clerk's going to ask you, whether it be your mortgage, copy of your lease, copy of the utility bill to prove you're there, and then copies of the birth certificates or whatever, just so we can create the record. Because we see that all the time whenever there's disasters, is people are under the assumption they have a mayor's verification because they're a registered voter. We tell them it's a different list. Totally different list. If you've never needed the government whatsoever to prove that your kid's from this village to go to a school, or you need a government ID or anything like that, you would have never needed a mayor's verification. So now we're telling people, get it now while the systems are not as inundated, because once we kind of get the calls, it's going to, we're still producing the verifications for SNAP and for other assistance. But, we know that once this, everybody has to get, if you want this additional funding from the federal government, you need to get a verification. We know we're going to get flooded as mayors with that.
Right.
You got to go handle hundreds at the end of the day. So we're telling people, call now, this morning at 8 o'clock, call your mayor's office, find out if you do have a verification, have them reviewed with you over the phone. And if it is, then you can be comfortable. But if you don't, we can help create the record.
Mayor, what about part of the big conversation we've been having, the last week is rent being due, and people kind of going into that first pay period with no paycheck. What are you seeing out there in your village in terms of residents who may be reaching out in need of some kind of assistance?
They're asking what programs are there. They're getting, we're getting the calls. we have some people calling and even driving to Gura, even though they're closed, and they see us outside as we prepare the meals and get in, as we mobilize. And they're like, Mayors, do you know when they're going to open? I'm like, I don't know. I can't tell you. I'm not Gura, but, and so they're very nervous and they're scared as well to figure out what's going to happen. So I think as long as there's no local legislation preventing it and there's no national kind of word of saying, okay, you can't be evicted. And so they're concerned about either they're going to get late fees or they're going to get, they're going to have to pay these penalties. And so they're just trying to figure out, and they don't know if that stimulus whatsoever is going to take 2 weeks, 3 weeks. I hear it's going to take 3 to 4 weeks. Is that going to be enough to cover? So that means they're already going to be a month and a half behind in paying. So we don't know what it's going to do. So it's very, I feel for all those people that do have to make those decisions and have to pay those rents. Even the businesses that have to pay rent, it's the difficult thing. They've been shut down for so long. So we're going to see what this is going to do.
Yeah, I was talking to a restaurant we've been picking up lunch at, and they're doing the takeout only. But, it has been slow. And they were just telling me, Chris, we still got to pay rent. The landlord of the place has sent the notice. And so, it puts me in this interesting position because they're like, hey, what do you know? And I'm like, well, I know that they can't evict you, but what are you going to do? Tell your landlord, like, you can't evict me? How's that going to work?
Yeah, so it is difficult. And so the mayors are bringing those concerns. We are airing them. We are sharing them with people that are willing to listen to us on that end. Mayor Savars brought up a good point yesterday with the food delivery for DOE. She's saying, can we ask Sodexo to buy local from the farmers so we can kind of support them and be shore up that segment of our economy, because they have the vegetables and stuff like that that are easy to go out and, they're sitting on crops that are just growing because there's no, they can't take it to market.
Right.
So, is there a way that we can at least help that segment of the population, our farmers, and support our local farmers? So she made a good point, and, it's going to be looked into and see how they do and see however Sodexo does their procurement. But, if we're serving 10, 12,000 meals a day, at least use
and running out, Mayor. They're running out of meals because there's so many people who you have to eat.
They used to allot mayors food at the end of the run, to hand out to people in poor segments of our population. And we normally get the call like at 12:45, mayors, okay, we have 50 meals left over, 100, and we would be able to go out there. But now it hasn't been that way since I think the second day. I think we only got the first 2 meals, which was the flatbread pizza and chicken nuggets, and after that it's been so popular, and which is great. We're glad to see it kind of taking away, but going out there. But it's difficult to see, and what do we do? How do we feed the other people who are not have that ability to go out? About the weekends too. We had people inquire us about weekends. Is there going to be food on the weekends? So we already know that as the end of the month neared, people were already desperate because they were already out of whatever assistance they didn't have, and being home, you're feeding 3 squares meals a day plus snacks. So if you're on any public assistance, it took a toll on them financially with that card. So everyone got kind of desperate in that end.
I was talking with Nestor in the back of the newsroom, and we were wondering if and hoping we don't reach a point where we see the government of Guam, going out and buying up. Because what you're saying about them buying the golai, getting all the vegetables, I mean, maybe that's something the government should look at. Let's buy up these farmers' stocks and find a way to get it out to people who need it. That's something that we were talking about government, buying stockpiles of food to hand out for assistance, and it's pretty real out there. And
yeah, we want that, and one of the options that we also offered is, and for these end of the month situations, is let's tap into the MREs. We know they're out there. We know their stockpiles, their strategic stockpiles here and there. And if we could use the MREs, the military, I mean, that's at least that's nutritious, and we know it's able to help people. So,
I did have one question. Did you have some more, Chris? Do you want to?
No. Go ahead.
No, I just wanted to follow up on something that you had said regarding positive COVID patients that are from your village, and I just wanted to see if you could share with us how they're feeling, how they're coping.
It's hard for them. It's heartbreaking most of the time. Most of the time when I talk to the family, it's because they are Manumco and they don't understand the whole COVID thing. So they feel alone, abandoned. That family can't come see them. That they can't be held and touched. And they're either seen through a window or and fed. And then so they don't understand the whole ordeal of the home isolation. And so it is heartbreaking, and they feel very alone and very sad. So we're trying to figure out a way and to do this as well. And we told, the families are not breaking protocol. They're doing what they can, but they see that it's taking a toll on their mom or their dad. And so it's, to hear those stories and to get those phone calls that, when we call and follow up saying, how's mom doing? How's dad doing here? And they say, not good. They're confused. They're alone. Some of them have early dementia and they don't understand what's going on. Why are they stuck in their room? Why are they being told they can only do this and that? And, it's hard on the caretaker and it's hard on the individual. And so I'm just waiting for those days to come where they can be cleared. So, we're kind of counting down the days for them to kind of be able to get retested twice so it shows negative, and then they can kind of enter back into their normal daily life as a Banamco, because they want to go out and garden. They want to go out and, hug their grandkids and everything like that. And they're being told, no, Nana, you got to stay here. And no, Tata, you got to stay here. And when I hear those stories, it just brings tears to my eyes. And I constantly tell the families, just keep trying to motivate them, get anything that they can do to get contact with the people out there. And for some of them, some of their loved ones are in SNU or at a GMH, and that's even more hard because they really are alone.
Yeah, Mayor. And I mean, just in talking with, Dorgan Seuss's family and how they weren't able to say goodbye. It's just, man.
Yeah, it's hard. It's a disease that gets you both ways, because you're alone, and that's it's the nurses see the families, hear the families please on the phone saying, can you at least bring your phone in or a walkie-talkie in to talk? And there's a lot of restrictions on that, so it's very difficult. So my heart goes out to those families. So yeah, and we'll see, and we'll see about this arrival of the ship too. We'll see. We're going to see how that's going to.
Yeah, how do you feel about that? Some people are, don't let them out. But, what the military is saying is that they're if they test negative, right, that they're going to allow them to be quarantined.
I support our military. I think they do a fantastic job. But if they're negative, I think really just send them back to their homes of origin. Let them home isolate. If home isolation is good for everybody else, send them to the home. Send them back to their states. Because we have a lot of people on that ship that are from Guam that I'm pretty sure their families would be happy. If they're negative tested, go home then. Go back into, because I don't see why we'd put somebody negative into in a place, but then we're out here populated by people who are positive in our communities. I don't see how it makes it, why they are treated differently. Otherwise, put every resident up in a hotel that we can kind of self-isolate there. But, I think send them to their places of where they want to go, where they can home isolate and hunker down for a while, because I doubt that ship's going to go out anywhere. Anyway,
right.
So
yeah, if you heard the press conference we played, they're saying that it definitely not going to be resolved in the next few days, and they're thinking weeks, maybe months.
Yeah, and they're flying in military personnel, medical professionals, from the Marines that are going to be here.
Well, if they could do it for a cruise ship, the Diamond Princess, and then put them in a base, they put them in several bases, they flew them out. I don't see why they can't do it here. I wouldn't do it here locally into our economy and into our thing. I know our hotels kind of need the business, but for the sake of our people on that end, I would just, get those planes ready and put them up and then bring them back and let them ride it out in Texas or in, California, whichever else like that, because they're more equipped to handle that. Because I am concerned for the hotel workers. I am concerned for the bus driver has to take them there. I am concerned for the other people. And I saw Dave's interview, his stuff about, people being mixed up. They're not constantly under watch, so they're going to get bored knocking on somebody else's window, and especially that they're all on a ship, they already know each other, so it's not like total strangers. Yeah. So I say just get them on a plane and get them out.
It's a lot of planes.
Yeah, it's interesting. It was when listening to that press conference with Admiral Manoni, and obviously the military has their procedures, and he was saying no contact, there's no touch policy, and the hotel workers are going to be sequestered in the back. But what I think those plans don't take into effect is the chance of human error. And I mean, military might be in a lockstep in their response efforts, but the hotel workers maybe don't have the training. So there is always that wild card factor.
I think they just have to understand, if a hospital worker in a hospital environment can get infected, what more a hotel?
Yeah, we just talked to a nurse yesterday from New York, Chamorro nurse, and she was saying I was wearing the whole full PPEs, and that's the thing that what's insidious about this virus is that how contagious it is.
Well, and this is a comment from one of our people watching on Facebook, and she brought up a good point. There's coronavirus in their hometowns too, so no matter where you move them.
But I'm not saying either their hometowns or the bases that took the people for the Diamond Princess. Those were regular American citizens, and they were quarantined. The ambassadors, they pulled out of China, and they put them on a plane, and they shipped them somewhere and hunkered them down inside a military base, which was a lot easier than, because like I said, if a hospital can catch it, what more a hotel that for some whatever reason a bed sheet is not cleaned properly or a utensil from eating is taken and then suddenly that just grows that way. So, there are concerns. Hopefully the professionals are going to kind of weigh that all out. But if it was up to me, I'd just charter a bunch of planes and send them out.
All right.
Well, there you go,
That's
Mayor
one way of looking at it.
Robert Hofmann.
Thanks, Mayor.
Hey, thank you, Mayor.
All right, take care.
Okay,
Keep us
be
posted.
safe.
Remember, you're our guy in Sinajana. Well, just real quick, Mayor. I know the reason why we had wanted you to call originally was some burglaries in your village.
No crime.
I saw some pics that were on your neighborhood watch WhatsApp chat. Can you tell us a little bit about that?
Sure. It is unfortunate that we're still having to do with these with crimes in the midst of all this people sheltering in place, and we just ask our people to remain vigilant out there. There was an incident the other day in Affamy, and somebody kind of broke into a truck. It wasn't not a shooting. I think some of there is a photo of a bullet hole. They probably did use a gun, but to break the window to get in, and they took the person's wallet. But it was classified as a burglary, and it happened around 1 and 4 in the morning. So we're just asking people. So last night, some people who are in that area specifically have really stepped up. So they're listening to the dogs, they're listening to nature out there, and those people that do graveyard and have to come in, they're also out there, so they're concerned. So I think they're really going to step up and kind of monitor their area. But the odd part is it happened in a very secluded part of Affamy, so that person should have been seen going in and going out.
You guys have a police station right there.
And that's why very brave of them for one to fire a noise that, because I'm not sure what it was. So they're trying to figure out if it was a pellet gun that shattered the window, it was a bullet, or some people have their own imaginations on that end. But I'll let GPD do their investigation on that. So, but we're glad nobody was hurt, and we are in contact with the person, and we've offered our assistance and what they can do to kind of just secure their belongings better.
Okay, Mayor. Thanks for that.
All
So
right.
just, everybody just be vigilant and know that there are some, like Bree said, what'd you say, knuckleheads?
Yeah, some knuckleheads out there.
Oh, boy, man. It's not the time, guys.
I know.
And so, Sergeant Paul Tapao, they've changed their whole response procedure because of COVID-19. And so they are asking the neighborhood watch groups to kind of step it up a little bit and fill in those gaps where, we've got police deployed to these quarantine facilities. So we're all stretched thin, we're all stretched thin. So 7-Eleven, KUAM FM, Agotnia, Guam. We're going to get to